Hello, this is Aaron Shoemaker, and I'm here today with Mary Ann to talk about the Navigator program we have within the St. Vincent Medical Group. Currently, we have 5 navigators within the medical group, and they work primarily at 5 sites within Indianapolis. We are hiring another position that will work across the state for referrals from anyone who doesn't have a navigator in their office. So we want you all to know about what we can do with navigation in the state. So, Mary Ann, tell us about the patients that need navigated.
Well, one of the things that I've learned over the past 3 years is that any patient might need a navigator because there's a lot of different needs that are identified. I work primarily with the Anthem commercial patients as well as Medicare Advantage, but will work with any patient within the practice if there's a need identified. And in fact, recently was contacted by one of the cardiologists to assist with one of her patients that is not a patient in our practice but has a great need for a navigator. So that's been a recent experience I've had.
Great. What do you do in the navigation process?
Work a lot with the transitions of care with the patients. If they're admitted to the hospital, we go and visit them and meet the patients and families there, and then we do a follow-up phone call, make sure they understand their discharge instructions, medication reconciliation, which is extremely important. If they go to a rehab facility, we make that connection with the rehab facility and then follow that transition of care to home. The other thing we work very closely with are the home care folks so that we can stay connected with them and keep them updated as well.
Great. I know in our office, our patients love the relationship they have with you, managing them in the office, in the hospital, in the extended care facility. And I know you have a story to tell us about some success in doing that. So tell us that story.
And this is from this morning. I have a patient that I started working with about 3 years ago, and she is chronically ill. Had been in the hospital quite frequently into the ER. We have reduced both the ER and hospital admissions with this lady. But she actually fell recently, went in the hospital, injured her knee, and came in for a follow-up this past Tuesday. Met with she and her daughter in the practice and identified a lot of needs that she had. One, that she didn't have her ortho appointment until July the 23rd. So I called this morning and got it scheduled for next Tuesday. And yesterday we also did a med rec with the facility, with the skilled facility, and found that there were about 5 medications she was not discharged on that she should have been on. So we were able to call and get those reordered for her at the skilled facility. And then the third thing was her insulin dosing had dramatically reduced when she was in the facility. So I called the endocrinologist, and that nurse practitioner is going to call that facility today and discuss the insulin dosing with them.
Excellent. So it sounds like we probably avoided a readmission there.
Hopefully.
Well, thank you for sharing today, Mary Ann. I wanted to let you know about this program and give you some takeaways today on what navigators do. They're an important part of the team in all aspects, from pediatrics, internal medicine, and specialty. Providers have the opportunity to use our navigators. The program that we currently have, especially in the Anthem group, has shown decreased emergency room utilization as well as decreased hospitalizations per 1,000. So our data is excellent that this process is working. The program is focused around Anthem and Medicare Advantage right now, but if you have a patient who's in need, as Mary Ann recognized, let us know and we'll work with that patient. The way to do that is to contact us right now if you're outside of an embedded location where you know the navigator is there. If you just need them in your office, then email Suzanne Engel, and that number will be provided in the email that comes out with this video. And lastly, navigation for all patients will grow. This is an important part of what we do in managing populations. It's showing improvement. It helps patient outcomes in the end. Helps us as providers have satisfaction in taking care of those patients. So thank you, Mary Ann, and thank you. We'll talk to you soon.